Chương trình truyền hình Sống Mạnh do công ty Sống Mạnh thực hiện. Công ty Sống Mạnh là một công ty bất vụ lợi, được thành lập từ năm 2001. Chủ trương của tổ chức Sống Mạnh là đem lại cho người Việt những kiến thức thực tế và chính xác về y tế, sức khỏe, đời sống và gia đình, hầu nâng cao được ý thức bảo vệ sức khỏe và hạnh phúc trong cuộc sống. Liên kết với chúng tôi qua trang mạng songmanh.net, YouTube channel www.youtube.com/songmanh.tv hoặc email cho chúng tôi tại contact@songmanh.net. Đây là chương trình Sống Mạnh, được phát hình hàng tuần vào lúc 7 giờ 30 phút tối thứ 6 hàng tuần và sẽ được phát lại vào lúc 4 giờ chiều hôm sau trên đài truyền hình Nét Việt và sẽ được lên YouTube channel sau đó qua băng tần của Nét Việt YouTube để quý khán giả tiện theo dõi. Chương trình Sống Mạnh TV hàng tuần sẽ có những tiết mục định kỳ sau đây: tin tức y khoa sống mạnh, sống sao cho mạnh với bác sĩ Trịnh Ngọc Huy và những tiết mục văn nghệ có tên Sống Mạnh với âm nhạc.
Kính chào quý vị, đây là chương trình Sống Mạnh với bác sĩ Trịnh Ngọc Huy và Phạm Phú Nam. Hôm nay chúng tôi có bác sĩ VyVy Trinh, chuyên khoa về sản phụ khoa. Bác sĩ VyVy Trinh tốt nghiệp tại Kaiser ở Santa Clara và hiện nay đang hành nghề tại Providence Community Healthcare Center ở trên Providence. Xin kính chào bác sĩ VyVy.
Hi everybody, xin chào.
Today we will talk about birth control pills, thuốc ngừa thai, và bác sĩ VyVy sẽ bắt đầu chương trình thuyết trình của bác sĩ VyVy.
Hi everybody. Okay, so a few weeks ago was my first appearance on the Sống Mạnh show, and we talked about pregnancy do's and don'ts. Going forward, we are excited to be able to offer a series of lectures on women's health, and today's topic will be birth control. So what is birth control? Birth control is also known as contraception, and they are methods and devices used to prevent pregnancy. Planning, provision, and use of birth control is called family planning. Birth control is really important in a lot of people's lives for them to be able to make their own reproductive choices, to decide when to start a family and when to avoid unintended pregnancy. However, there is a lot of misunderstanding and lack of education about birth control and all the options that are out there. And sometimes this topic can be seen as controversial or something that's difficult for people to talk about. So today my goal is to break any myths about birth control and to give you comprehensive evidence-based information. So when it comes to choosing a birth control method, a lot of women and couples are taking into account a lot of different factors. They're thinking about how effective they want the birth control to be, convenience, popularity, cost and market availability, religious and personal beliefs, effects on sexual satisfaction, reversibility, side effects and risks. There are some people with certain conditions who should not use certain types of birth control, for example. STI protection or protection against sexually transmitted infections, as well as the effect on menses. So first, I will begin with non-prescription methods. So these are methods that people use to reduce the risk of unintended pregnancy without needing a prescription from a doctor. Of course, the number one is abstinence, is just avoiding sex altogether. And of course, in theory, if people are not having sex, then the chance of pregnancy is 0. And that is really what works for some people. It's a personal choice. However, abstinence-only sex education in schools is associated with higher rates of teen pregnancy. And even though it may be our hope that, or perhaps within a family, for example, it is the hope that a young person is not engaging in sexual activity. It's important that people still have comprehensive sex education. So, of course, abstinence itself is an effective form of birth control. However, abstinence-only sex education is associated with higher rates of accidental pregnancies. The next method is the withdrawal method. So this is defined as withdrawing during intercourse prior to ejaculation. It is one of the most common and oldest methods used. Throughout this presentation, I'm going to be using these two terms, perfect use effectiveness and real world effectiveness. What this means is perfect use is if someone is using that method 100% of the time completely correctly. And that is always associated with a higher rate of effectively preventing pregnancy. However, there's also what we would call real world effectiveness, which takes into account human error and the fact that people are often using these methods not 100% correctly. So, for example, the withdrawal method, if people are using the withdrawal method 100% correctly every single time, then the effectiveness is 96%. 96% of the time, people will avoid unintended pregnancy. However, with real-world effectiveness, the rate is 73%. So still pretty effective, but obviously lowers quite a bit.
Bác sĩ VyVy, tôi nghĩ vấn đề the withdrawal is not that easy. I think, for male, we got a lack of control, and for female, she doesn't feel it. So I think in a sense, real life, I think in the US, it doesn't really work out very well. I don't know other third world countries, how much education and knowledge that the youngsters have and know what to do. This is what my comments.
Yes, absolutely. I completely agree with you. And as an OBGYN physician, I am often encouraging my patients, especially teenagers and young people for whom it's very important to avoid pregnancy, don't rely on this alone. That being said, it is associated with a lower rate of conception than not withdrawing. So, yeah, I agree that it is an unreliable method. I think you can think of this presentation as going from least reliable to most reliable. So we can move forward.
Okay.
Okay. So moving on to condoms, the most commonly known and common available is the male condom. These can come in a variety of forms, made of latex or other synthetic materials. They can come with lubrication or not, and they can come with spermicide or not. They are actually pretty effective if used correctly, with perfect use effectiveness being 98%. However, real-world effectiveness is 85%. So some factors that might lead to improper use would be not knowing how to apply it well, using an expired condom, the condom breaking, or just not adhering to it. People starting out using it feeling uncomfortable, and then over time, perhaps not using it 100% of the time. For it to really be a reliable form of birth control, it needs to be used consistently and properly. lesser known and less widely available is the female condom. I would say that this is very infrequently used. In fact, I've never prescribed it or seen it myself personally. But the concept is that it's a loose fitting sheath made of polyurethane, with a synthetic material with rings on both ends. Another word for this is an internal condom. Again, perfect use effectiveness is pretty good at 95%, but real world use is 75%. Moving on to spermicide. So spermicide is a gel or film that can be applied into the vagina and is used to kill or immobilize the sperm on contact. It prevents sperm movement towards the egg. Again, this is also used less frequently. I think with there being so many other effective methods out there, not a lot of people commonly use spermicide alone. They might use a condom that has spermicide, and that's for a good reason. It is not that effective. Perfect use effectiveness is 82%, and real world effectiveness is only 71%. And then finally, in the non-prescription methods is natural family planning. And I want to take a moment to talk a little bit about this in a little bit greater detail, because in my experience, there's a lot of interest in this. There are a lot of women and couples out there who, for a lot of health-related reasons or personal reasons, want to avoid hormonal birth control and want to know about their own bodies and use that knowledge to achieve their reproductive goals, whether that's avoiding pregnancy or planning a pregnancy. So the definition of natural family planning is using knowledge of your body's natural ovulation and menses to avoid pregnancy at the peak of your fertility, avoid having sex at the peak of your fertility to prevent pregnancy, and really only having intercourse on the days when the odds of ovulating and the odds of conceiving are very low. In recent years, very excitingly, there was the publication of a new app called the Natural Cycles Birth Control app that is the only FDA-approved birth control app. So this is an app that people can download on their phones and use some smart devices. There's a ring that you can purchase, or you can use a thermometer. And what you do is you measure your temperature daily. Sometimes you are also using home test kits that you can purchase where you are testing for a hormone in your urine every day. And the app uses this data to tell you if you are ovulating in a given period of time. And if you are ovulating and you don't want to get pregnant, then that would be the week or so to avoid having sex. And the app will also tell you when you're not ovulating and the chance of conception is low.
Dr. VyVy, how popular is that method when you see your patient? I'm not a gynecologist, so patient never asked me that question. So for my curiosity.
Yeah, I think it is increasingly popular. There is a real appetite and hunger for more methods that don't use hormones. The reality is that the vast majority of birth control we have to offer use hormones. I think hormones in general are safe and an incredible technology, and I am really encouraging people to not be afraid of them as long as they don't have a major health reason to avoid certain hormones. But there has been a rise in a lot of literature, both scientific literature and popular literature, that is exploring people's experience on hormones. I think for a lot of people, it can be associated with weight gain or mood changes or changes in libido, or sometimes at least the perception of those things. And there's also a real hunger for people to understand their bodies and not just put it on a pill and hope for the best. So I'm very sympathetic to that appetite. So I do think interest in this is really increasing. The other reason I think people are increasingly interested in it is that we can use the same app for the opposite. It can really help couples who want to start a family, but are struggling to conceive. It can help them conceive. It can help them know when is the best time to have intercourse to maximize their chances of conceiving. So I think that the more people know about their bodies, the better. And I think the one downside of this method is it takes a lot of comparatively, it can take a lot of planning ahead, a lot of thinking, a lot of self-education, and there's more room for error, right? Like perhaps you have a long distance partner and they are only in town for the week you happen to be ovulating, and you kind of go against the app's advice or something like that. You can imagine a situation where it's less reliable than just being on a pill, which should protect you from pregnancy at all times of your cycle. So I think it takes a mature user. But I think there's increasingly a lot of interest in this. So I'm glad that it's becoming more and more available to people.
Okay.
And on that note, if used correctly, truly correctly, as you can see here, it's actually just about as effective as some of these other popular methods, such as the pill. So yeah, but I think the chances of using it incorrectly are probably a little bit higher, and hopefully with more public education, that efficacy can increase over time. Okay, moving on to prescription methods. So these are methods that you would need a provider's prescription for, obviously. So I'm going to go through short-term methods first, going from the shortest term to what I might call medium term. So we've got the pill, of course, which is something you take daily. Then there's the patch, which is something you change weekly. Then there's the ring, which is something you change monthly. And then there's the shot, which is Depo-Provera, which is something that's given every 3 months. So starting with the pill, I would say it's the most famous, most commonly known form of birth control. And when you hear the pill, most likely what you're hearing about is the combined pill. So that combines 2 of the main hormones that we use in birth control, which is estrogen and progesterone. There's lots of different formulations of this, dozens and dozens. And basically the different formulations slightly tweak the types of progesterone and also slightly tweak the doses of each hormone. Which is why I think a really wise piece of advice is if somebody starts the pill and they don't like it for whatever reason, maybe they noticed mood changes, skin changes, I would encourage people to be open-minded and try a different pill because there are so many varieties out there. One very cool thing about most forms of hormonal birth control is that they can be used for not just birth control, but also to help regulate people's menses. So some people have very unpredictable periods or very heavy periods or very painful periods. And oftentimes the pill can be used to help regulate that period, or it's safe to skip the period altogether, which basically means taking the pill continuously, and rather than at the end of each pack, there's usually a placebo pill that in which someone's period comes. That's getting into too much detail, but I think the important thing is pills can be used not only for birth control, but to also strategize around a period if someone's period is painful or problematic. And I would encourage people to talk to their doctor about that. Importantly, this form of birth control, like a few others that I'll review going forward, is not safe for everybody. It's safe for the vast majority of women of reproductive age, but the reason I would argue that it requires a prescription is that there are some people who should avoid it, specifically people with uncontrolled high blood pressure, migraines that come with aura or visual changes, people who are active smokers, especially heavy smokers, and a few other medical conditions.
So, Dr. VyVy, in the United States, the patients still require physician prescription for these birth control pills. So it's not that, for some places, it's not that easy for some patients.
Yes, that is correct. Although, maybe what I'll do is I'll do an addendum after we finish filming this. I do believe that recently, within the past 6 months, the FDA studied the data about the safety of birth control pills and recommended that they should be made available over the counter. The idea being that widespread access to birth control, the benefits of that for public health outweigh the risks. Now, has that actually been enacted and is it available without a prescription? I don't think so. But if I recall, that has been actively studied by the FDA lately. As of right now, people still need a prescription for birth control pills, though.
Yeah, I think, as you said, there are so many different methods besides the birth control pills that people can avoid pregnancy. But I think there's a certain population who just want to have a woman to have a baby for whatever reason. So I think that's a real issue.
Yes, absolutely. I mean, part of why we wanted to make this women's health series is, Dr. Trin, you and I both observe that women's health is under attack and women's reproductive choices are under attack. And that obviously is true around the issue of abortion, but it's increasingly true around birth control as well. Okay, so back to the pill. So, like I said, when you hear the pill, you're most likely hearing about the combined pill, but there is also the progesterone-only pill, also known as the mini pill. I think many people's personal experience with the mini pill would probably take place after they've had a baby. It is often what doctors will prescribe in the postpartum period for a couple of reasons. One is after you've had a baby, your risk of having a dangerous blood clot is a little bit higher, and that risk becomes even higher with the standard pill. And two, the estrogen in the combined pill can also affect women's milk supply. So a lot of people might have personal experience with the progesterone-only pill in the postpartum period, but some people are on it throughout their lives because perhaps they have one of these contraindications to the combined pill, whether it's high blood pressure or they're a smoker or something like that. So technically, the mini pill is safer. However, it does have a higher failure rate, and it's less forgiving for kind of human error. So it needs to be taken at the same exact time every day in order to be effective. In general, just looking at the pill as a whole, perfect use effectiveness is actually quite high, 99.7%. However, I would say it's one of the methods that is most prone to accidentally missing a pill or forgetting a pack while you're on vacation or what have you. So real world effectiveness does drop down to 92%. Moving on to the patch. Again, so the patch is another combined hormonal method, which means once again, it has estrogen and progesterone, which means once again, the same group of people who we would want to avoid the pill should avoid the patch. Uncontrolled high blood pressure, certain types of migraines, personal history of blood clots, smoking, etc. Those things are overall pretty rare in people of reproductive age, so most people can have any of these methods, but the way this works is you place a patch on your skin and you change that patch weekly. So a benefit compared to the birth control pill is rather than having to remember something every single day, you put an alarm on your phone, you're changing it once a week. So it does reduce that chance for human error by quite a bit. The effectiveness is about the same as the pill. If used perfectly, it approaches 100. If used in the real world, it approaches 90. People can have local skin reactions, and it's thought to potentially be a little bit riskier than the pill in terms of blood clots because of the way the medication is absorbed. So just something to consider. Moving on to the vaginal ring. So once again, the pill you have to remember daily. The patch you have to remember weekly. The benefit of the ring is you change this only monthly. And so again, can potentially be more effective for people who have trouble remembering something on a daily basis. It's another combined method. It's a thin, flexible ring. You insert it yourself into the vagina, and it's left in place for 3 consecutive weeks. After 3 weeks, you remove it. You have a week off. That's when you get your period. And then the ring is placed back again after a week. Kind of like with the pill and with the patch, the ring can be used strategically to just suppress your period safely if you wanted to. That would be something to talk to your doctor about. People, I think that this is an excellent method for people who are very comfortable placing and removing something from their own vagina. So people who are really comfortable using tampons, for example. It's not the right method for people who don't feel comfortable doing that, but it can be a really popular method for many people. The convenience of not having to remember something daily. Effectiveness, again, it is very similar to the previous 2 methods we talked about. And then lastly is Depo-Provera, which is known as the shot or the injection. This, unlike the ring, the patch, and the pill, is a progesterone-only method, which means it's safe for pretty much everybody. There's almost no contraindications except for people with very rare allergies. And this is a shot. You come into the clinic, you get a shot, feels like a vaccine, and that's done pretty much every 3 months. It's a bit more effective overall if you look at this number of real-world effectiveness compared to the pill, patch, and ring at 97% compared to 92%. And I think that has a lot to do with it lasting a whole 3 months before people have to remember to take the next dose. Anecdotally, and I think this is probably true on a population level, that this tends to be very popular among young women because it provides a lot of security in the method. People don't have to remember to take something on a regular basis, but it can also feel more approachable than some of the longer acting methods I'll get into next. The side effects can include weight gain. It is the one method of all the methods that is most strongly associated with weight gain. It also is known to lead to irregular, unpredictable bleeding. Most people will have unpredictable bleeding for the first 3 to 6 months or 1 to 2 doses. And then after that, most people stop having a period at all, which a lot of people really enjoy, not having a period. Lastly, it can lead to a decrease in bone density. This is truer among younger patients who are on it for many, many years. But once someone stops using the Depo-Provera, studies show that the bone density improves pretty quickly. And so it's all about weighing costs and benefits. If it's a reliable method and the only method that someone really feels comfortable doing, then it is overall safe and should not be discouraged. Okay, and then moving on to long-acting reversible contraceptives, also known as LARCs. I think you will find that a lot of OBGYNs are very passionate about LARC methods because I think that they are often misunderstood and can seem very intimidating, but are one of the most effective methods of birth control out there. And I want people to be informed about them. So there's basically 2 methods. One is the Nexplanon and one is the IUD. And basically that means there's an implant in your arm or there's an implant in the uterus. And both of them are leave it and forget about it methods. So starting with the Nexplanon, which is an arm implant. It's a thin, flexible implant that goes right under the skin in your forearm. So the placement is usually, if you feel this hard part of your elbow, it's usually medial to that by about 5 centimeters. And that stays in the arm and is effective actually for up to 5 years for most people. Technically, the FDA has only approved it for up to 3 years, but studies are very consistent that it is actually effective for up to 5 years for women with a BMI 30 and under. It's probably effective for people a little bit with heavier weights than that, but to err on the side of caution, that's kind of the cutoff that most clinics will use. It releases progesterone. And again, that means it is safe for pretty much everybody because it does not have estrogen. It can be used for people who have those other comorbidities, so hypertension, smoking, etc. And as you can see, it's extremely effective. It's 99.5% effective. And in fact, in some studies, that is more effective than a tubal sterilization procedure. The benefit, however, compared to sterilization, is that it is reversible and that when somebody is ready to try for pregnancy or wants it out for any reason, maybe they don't like the side effects, it can be removed right away. The main side effect is irregular bleeding. Specifically, what many people's experiences is that in the first year of having the Nexplanon, most people will stop having a period, and then by year 2 or 3, there may be irregular bleeding. So that's just something to know about. And then moving on finally to the other type of long-acting reversible contraceptive is the IUD, which stands for intrauterine device. It's a little T-shaped device, as you can see, that is inserted in the clinic and stays in the uterus. And there are 2 types. There's the hormonal IUD and the copper IUD. So for the hormonal IUD, there's a couple of different brands out there. They all tend to have this name that sounds like a pretty girl's name, Mirena, Skyla, Kylena, I don't know why, but they all release progesterone and they all act quite locally. And this is So the amount of progesterone in both the Nexplanon and the IUDs is actually quite low when you compare it to the pills and when you compare it to the pill, patch, ring, or injection. So for people who worry that they're very sensitive to hormones, I do encourage them to consider one of these methods because all of them actually have the way the technology works is it releases quite a low dose of hormone every day. And so people who are very sensitive to hormones may find that they're actually a good fit with these. A benefit or a side effect of the hormonal IUD is it does decrease people's menstrual blood flow. So oftentimes I have patients who want to get the IUD not so much for birth control, but because it stops their periods. And that can be really desirable for specific individuals for any number of reasons. It's effective for 3 to 8 years, depending on the brand. I would say the most common brand out there is the Mirena IUD, and that one is effective for 8 years. And as you can see, it's highly effective with a 99.8% effectiveness rate.
So Dr. VyVy, why this method only effective for 8 years is a mechanical instrument to put under the uterus? Why only for 8 years? Because there's some chemicals in there?
That's such a good question. So the hormonal one does have hormone in it, and that will run out over time. The way it works is it thickens the cervical mucus. It doesn't reliably suppress ovulation, but there is some suppression of ovulation. And yeah, because there is an active ingredient of that progesterone hormone, eventually that will run out. So it's not just mechanical. The copper IUD, and I can go back to my screen here, does not have hormone. It's just made of copper, which creates a hostile environment to sperm. And because that one is not imbued with a medication, I can't really tell you why it eventually loses its efficacy after 12 years. But our recommendation is to get it changed at that time. I don't know if over time the copper and its effects on sperm loses its effectiveness over time and is less hostile to sperm or less effective at killing sperm.
In regarding about the cost effectiveness of this IUD versus the one you put under, you talk about putting the skin, are they expensive, especially IUD requiring, I guess, a physician to insert into the uterus? So does that make difference in pricing, the two methods?
Oh, that is a very good question. I don't know the answer to it. I know from the patient-facing side, in many states and on many commercial and state-run insurance plans, contraception is covered. It's considered part of preventive care. And I think both of these as long-acting methods, from what the bill the patient will receive, should be pretty similar. In terms of when I think about the resources that goes into placing either one of these, the Nexplanon is a little bit more approachable and is most likely going to be a little bit less resource intensive. Both placements are simple and most likely uncomplicated, but with the IUD, it can be more uncomfortable for patients, especially patients who may be younger, adolescent patients or patients in their early 20s, patients who have never had babies before. And so that can require a little bit more resources. So potentially some form of anesthesia if people need to, if it's going to be really uncomfortable for people. Sometimes we need to have an ultrasound available to confirm placement. and sometimes it could require multiple attempts. The Nexplanon is extremely straightforward and very approachable, so I could see it being often less resource intensive for a clinic. That being said, they're all commercial products. I don't know what proprietary considerations are involved. I don't know if like each product costs more or less. The IUD has been around for very long, especially the copper IUD, and is widely available around the world, including in the developing world. So I can imagine that for a lot of reasons, it's cheapest, but I'm not really sure.
I think I talk about that because things have changed. During my younger time, it's not free for those contraceptives, including pills, including IUD. Actually, it does cost the patients a lot. I think now with your younger time, I think changed a lot. I think health plan now cover for the medicine, these procedures. So that's why to the patient it's not a financial heavy burden anymore.
Yeah. No, I think that's a really important perspective to keep in mind. I'm spoiled, and I think as a woman and as a physician, I am benefiting from years of activism and advocacy for these things to be considered in the bucket of preventive health and for coverage to be expanded. And I would say anybody who's out there who is considering these methods for whom cost is a factor, in many states, there are a lot of programs to help cover costs for this. And clinics like Planned Parenthood or other safety net clinics can often provide people with these services at a very low cost because that's good public health. The cost of an accidental pregnancy when somebody is not ready to have a baby and is really trying not to obviously costs so much more to our society than helping somebody access an IUD if they want it. That's the common sense thing. I'm sure that's not true in many states, but yeah, I don't know the specifics of how much each of these things cost.
Sure. Yeah. Right.
Okay, almost done here. So the important thing to know about the Paragard IUD, a lot of people are interested in it, again, because it's one of our few non-hormonal methods. That being said, it does tend to have the side effect of people's periods becoming a little bit heavier and a little bit crampier. And so if people already have heavy and painful periods to begin with, I like to encourage them to consider a hormonal IUD because, again, it is a very low dose of hormone, but can have a lot of good benefit. The copper IUD is effective for up to 12 years and, again, is really effective at 99.2%, although you will see that that's a little bit less effective than the hormonal IUD. I thought I would take a few minutes to talk a little bit about emergency contraception, which is seen in the news a lot, and to clear up any misconceptions about that. Emergency contraception is not an abortion pill. It is commonly known as Plan B, which is like a commercial name for one of the most common types. And it is taken in the 3 to 5 days following unprotected sex in order to significantly reduce the chance of the formation of a pregnancy. So again, it's intervening before a pregnancy exists at all, and it is not an abortion pill. There's basically 3 types of emergency contraception. There's what's commonly known as Plan B, which is also known as levonorgestrel. It's basically a very high dose progesterone. And it's best to take within 3 days of unprotected sex. It's technically the least effective of these methods, and so that's why taking it as close to the time of the unprotected sex is important. It's also a little bit less effective for women who are over 165 pounds. Importantly, it is available over the counter. Over the counter, it's pretty expensive. It can cost $40 to $50, and it can be free if you have a prescription. So that's just important to know. But those who are really in a bind, at least it is available over the counter. Another method is also a pill. It's known as Ella or ulipristal. It's more effective, can be used within 5 days of unprotected sex, and is also has a lower rate of failure for women who are heavier, so greater than 165 pounds. Lastly, a lesser known form of emergency contraception is the IUD. So according to the FDA approved one is the copper IUD, but actually all the IUDs can be used as emergency birth control. So let's say somebody has unprotected sex and really wants to make sure that they don't get pregnant. All these methods are available to them, including making an appointment at the clinic to have an IUD placed, which has the added benefit of having very effective birth control going forward. And, obviously the same forces that are trying to limit women's reproductive freedom and health in general have a lot to say about emergency contraception. I think the availability of emergency contraception is really important for public health, and it should be supported even by, or especially by, those who oppose abortion, because its wide availability logically means that it would lead to a lower rate of abortion. And additionally, a really unfortunately common setting in which this is used is in the event of sexual assault or forced sexual activity. This is something that's very often prescribed in that situation, so that somebody who has experienced something as horrible as that also does not need to worry, or needs to worry a lot less, that that incident would lead to a pregnancy. So very important. And then I wanted to talk briefly about permanent birth control or sterilization. So obviously everything we've been talking up until now are ways that we have to prevent unintended pregnancy, but also for that prevention to be reversible if and when people are ready to think about having a pregnancy. However, sterilization is also an option, typically for people who perhaps have had children but are done with childbearing, know that they don't want any more. Sometimes it's for people who don't have any children but absolutely know that they don't want any. So there's a lot of different scenarios in which this is appropriate for somebody. And basically, the main method for women is called bilateral tubal ligation or bilateral salpingectomy. The difference, on the left of the screen here, you'll see the different forms of tubal ligation, which is essentially tying or removing a part of the tube. These days, increasingly, the more preferred method is actually a full bilateral salpingectomy, which you'll see on the right here. And that's where the whole tube is removed. The reason that this is increasingly preferred is it's more effective. There's fewer accidental pregnancies with it. 2, there's fewer ectopic pregnancies with it. An ectopic pregnancy is a very dangerous scenario in which a pregnancy can implant not in the uterus but in the tube, and can be at risk of rupturing and causing major internal bleeding for somebody in early pregnancy. And removing the whole tube essentially eliminates that risk. And 3, interestingly, studies have shown that when we remove the whole tube, the rates of ovarian cancer in those people in the future go down quite a bit. And the reason is that a good percentage of ovarian cancers actually originate in the tube. So removing the whole tube is these days increasingly how we perform female sterilization. This can be done, it's obviously a surgery, and this surgery is done usually in one of two ways. So it can be done right after having a baby. So in the first 2 days after having a baby, it's called a postpartum sterilization. A small incision can be made right below the belly button, and the tubes can be removed through that little incision. Or if it's not done after birth, but done at some other time in someone's life, then this is usually a laparoscopic surgery or a minimally invasive surgery. Both are overall safe. However, neither is as safe as male sterilization, also known as vasectomy. And I think this is really important to include in any conversation about birth control, because as you can see throughout this presentation, the burden of family planning in our society falls on women. It's women who are taking the pills, the patch, the ring, the IUD, the implants, and we do not have many, if any, real methods for male birth control. There is the condom, of course, but I think it's really important to also talk about vasectomy for those who are certain they no longer want to father any children. This is an office-based procedure. It often uses just local anesthesia, which is so much safer than the general anesthesia that's required for female sterilization. And it is highly effective. So I encourage men who know that they do not want to father any children anymore, especially those who are perhaps in couples and have a family, and the two parts of the couple are considering how they can move forward and not have any more children. I think it's really important for men to consider this, taking on this responsibility, because as I said, otherwise the responsibility of family planning seems to fall entirely on women in our society. And I think it's important that we destigmatize vasectomy and educate people about it, and know that it's very approachable, very safe. People are back to work the next day. You just sit on a pack of ice. So I thought I would end our conversation there. Where to learn more? These are some great resources for people who want to learn more about birth control. Obviously, PlannedParenthood.org, reproductiveaccess.org is a great website as well. And then I found some great materials at UCSF. I'm sure a lot of universities and medical institutions will also have information on their websites as well. So that concludes our presentation, and I don't know if you have any further questions, Dr. Trin.
No, I think most of the question has been answered. I just want to make an editorial comments. I think in the United States, I think birth control pills and also prevention of pregnancy has been supported by the government and by the country. But I think in some other third world countries, accessing to a physician to get a method of preventing birth is quite difficult. Mm-hmm. And I would feel that I even said that the medication that you can get as emergency, not having baby is also very, very difficult. So I think that in some country they don't have that such access as we have in the United States.
Yeah, definitely something that needs to be improved everywhere.
Right. Well, Dr. VyVy, thank you so much for sharing an educational, informational topics about birth control, different methods to our viewers today. We'll appreciate that. And please say goodbye to our audience.
Okay. Thank you so much. Thank you so much for having me. I really enjoy doing this. And we hope to continue future episodes on women's health. So stay tuned. Thanks, everybody. Hello.
Cảm ơn quý vị đã theo dõi chương trình Sống Mạch với bác sĩ Trinh Ngọc Huy và Phạm Phú Nam. Đề tài ngày hôm nay cũng như tất cả những đề tài trước đều được phát hành trên Sống Mạnh TV YouTube. Xin kính chào quý vị.
Chương trình truyền hình Sống Mạnh do công ty Sống Mạnh thực hiện. Công ty Sống Mạnh là một công ty bất vụ lợi, được thành lập từ năm 2001. Chủ trương của tổ chức Sống Mạnh là đem lại cho người Việt những kiến thức thực tế và chính xác về y tế, sức khỏe, đời sống và gia đình, hầu nâng cao được ý thức bảo vệ sức khỏe và hạnh phúc trong cuộc sống. Liên kết với chúng tôi qua trang mạng songmanh.net, YouTube channel www.youtube.com/songmanh.tv hoặc email cho chúng tôi tại contact@songmanh.net.